Hello, everyone. Welcome back for this very exciting panel. I hope you had a good break and you are, fit for this very exciting panel. My name is Frank Béraud. I'm the CEO of Montreal in Vivo, which is the life sciences and health technologies cluster of the Montreal metro area. This region accounts for 80% of the Quebec's life sciences sector, with over 600 organizations operating in this field. So it's a real pleasure and really an honor for me to be with all of you today and to facilitate this, as I said once or twice, this very exciting panel that will cover the topic of positioning life sciences as an economic growth vector in Canada. So the session will explore really the strategic priorities for the federal government to ensure that the life sciences sector becomes an even more powerful driver of economic recovery and growth. So I have fantastic panelists with me today, and I'm sure you will enjoy their insights on the topic. So we will have Pamela, which is the president of Innovative Medicines Canada, the industry association for research-based pharmaceutical companies. We're also going to have Andrew McIsaac, the CEO of Applied Pharmaceutical Innovation, a non-for-profit organization that offers drug discovery and development services out of Edmonton. And Marina Massingham, CEO of AI Fred Health, an AI company that uses the technology to personalize treatment selection in depression and makes personalized medicine a reality. So I'll ask each panelist to introduce themselves further, and I'll start with you, Pam.
Great, thanks so much, Frank. Thank you, merci à tous et à toutes. So you did a great job of introducing where I'm from, representing the research-based pharmaceutical and vaccines industry. I have a background in the health world, bringing that broad perspective and lens into the work that I do. I'm very proud and privileged to be working with IMC, but bring, as I say, that health background, leadership roles in the Canadian Cancer Society and the Health Charities Coalition of Canada, the Canadian Healthcare Association, and others. And also, by the way, a stint in public service, working overseas with the Canadian Forces for about a decade, and time with Health Canada as well. All of that tends to inform the work that I do with IMC. I am speaking with you today from the traditional unceded and unsurrendered territory of the Anishinaabe Algonquin Nation, and I'm extremely grateful for that privilege. I also note that I'm wearing a little bit of pink over my basic black today. This is to acknowledge the International Day of Pink, which has one purpose: to create a more inclusive and diverse world. The theme this year is game over to cyberbullying. So I invite you to explore that world as well. So I just have to say, having listened to all the remarks so far today and really everything that's going on in our world, that I can't help but be inspired by the attention, this renewed focus on the life sciences sector as a real key to addressing the health and economic well-being of Canadians. And I know it came up in this last panel about health is wealth. The two are so intrinsically tied. I don't think we can lose sight of that. And also in terms of Minister Duclos' very thoughtful remarks earlier, I'd have to just highlight his focus on collaboration that might have been pandemic driven, but we all need to really make sure that it isn't lost as we go forward, that we continue to work collaboratively. That's going to be a key to achieving the strategic priorities around life sciences becoming this powerful driver. And also his comment about healthcare expenditures are investments, not costs. I believe that deeply myself, and it was just heartwarming to hear it come from Minister Duclos. And I'm waiting, by the way, this may be for the chamber, let's have a fireside chat with both Ministers Duclos and Champagne. I think we'd have a really wonderful conversation with that particular combination. So a couple of comments just to start us off. It occurred to me, given the diverse registration for the session, not sure how many are on, but why bother? What is this sector all about? And so a few statistics that might be helpful to those not as close to this particular sector. There was a report from BioTalent that came out just in December, and it tells us there are roughly 12,000 organizations in Canada's bioeconomy. Collectively, they employ around 200,000 people. That's based on 2019 data. More than half the sector, about 54%, is made up of biohealth companies, with R&D and manufacturing together accounting for nearly half of all the jobs. And if you move to the innovative pharmaceutical industry, I speak for, most recent Statistics Canada report based on 2018 data tell us that the sector contributes about 15 billion annually to the Canadian economy. We support over 100,000 high-value jobs, and in terms of research and development investments, about $2 billion annually. So all of this to say the life sciences ecosystem really not to be taken lightly. It is primed to be a major player in terms of driving Canada's economic growth and of course, pandemic recovery. So that's one observation. The second that I was reflecting on in terms of the question in front of us is what are the federal government's priorities? And obviously the federal budget is a bit of a litmus test in that. What did we see? Did it recognize the life sciences sector as critical to economic and pandemic recovery? Is there strategy behind the announcements? So in fact, there are quite a few positives. There's a proposed innovation agency. Don't have the details yet, wanting to know more, but very keen to find out more. Health human resources and programs to build greater health system resiliency, which of course was the theme in this previous panel. There's a call for a review of the SHRED program, tax program that is very, very welcome. A comment as well in the budget about new international research chairs being established and new ways to connect university researchers and business partners, among some other things. And of course, you have to look at all of these pieces in combination with the government's biomanufacturing and life sciences strategy from last summer. So I would say that IMC appreciated all of these announcements. We're fully committed to supporting the federal government, but I would say that we still need a comprehensive strategic approach. We need to move from one-off investments, and we need to address each stage of that innovation cycle if we're really going to be successful in creating a robust sector. That means looking at basic science, commercial development, fill and finish, intellectual property, and of course, product adoption. Now that altogether, that's innovation. The third comment I would make, I have four by the way, but the third is, and maybe I should have started with this one, let's learn from others. Let's learn from ourselves. We don't need to reinvent the wheel, as we've been saying. The how in terms of ensuring life sciences sector becomes a more powerful driver of economic recovery and growth. It already exists. We don't need to recreate it. So as an example, just at the pan-Canadian level, in 2015, we had the Naylor report on healthcare innovation. We've had 2019's HBEST report, the Health and Biosciences Economic Strategy Table, which really gave us some robust targets and KPIs. More recently, the 2021 Industry Strategy Council, which didn't focus on the sector, but certainly made reference to it. And of course, more provincial reports than I could possibly list. And I'd have to cite that the Canadian Chamber of Commerce has its own Life Sciences Council. It's providing a nonpartisan environment for all stakeholders to convene. It's going to be creating a roadmap using all of this information I've just cited within the year. So we don't need to recreate, we need to do. And I'd be remiss if I didn't cite, of course, some of the international examples that we have, in particular, UK's life sciences strategy. You know, is that a recipe for Canada to consider? Not to cut and paste, but really to use as a guidepost. And I wanted just to cite a couple of, one line really from that strategy. Their goal is to create an outstanding business environment for life science companies, one in which incentives and structures are aligned to support company growth, innovation, and investment. And it's underpinned by a world-class regulatory environment. And I love this last part, bringing to bear the full financial firepower of the City of London to support companies to grow. We may not have the City of London, but we have others. There's also Denmark, there's the Netherlands, there are many other global examples that we can use, again, not needing to start from scratch. The last comment, Frank, that I would make just as an opening comment is the provincial role. They are the leaders in so many ways. They've been at this already, even as the federal government really galvanizes and mobilizes its work. So they're so important to make sure there's alignment, that there's complementarity. We know that Quebec has had a strategy for a number of years and is launching its second generation life sciences strategy. Ontario has just released its inaugural life sciences strategy. Is British Columbia next? We think possibly. The Atlantic provinces working together. There may be others. So let's optimize that, that collective firepower, I'd say, of all the different players. So perhaps I'll leave it there, Frank, with these introductory thoughts. And merci beaucoup.
Thank you so much, Pamela. Andrew, your turn.
Excellent. Well, thanks so much for having me here. So my name is Andrew McIsaac, and I'm the CEO of Applied Pharmaceutical Innovation. What we are is a not-for-profit organization that sits at the intersection of academia and industry, focused on building out capacity within the life sciences sector. We're headquartered in Edmonton, where we've got about 40 staff and a network of about 100 experts. But we have operations in Calgary, sites coming online in Nova Scotia, some in Ontario, a little bit in Quebec, and more broadly across the country. And what we really focus on is the sort of non-IP strengths that post-secondary institutions can bring when it comes to the life sciences. So really focusing on the translational capacity that enables that early stage discovery to move forward. We work in a hybrid model where we have our staff working alongside academics in a framework that supports the de-risking of intellectual property. You know, from the broad standpoint here within Canada, I think we have a tremendous opportunity, especially over the next few years, to look at the life sciences as a core economic driver. And there's a couple of different areas that that would really support that growth. You know, right now, I think we rank about number 32 in the world for the commercialization of our IP. And, you know, a lot of that is focused on, you know, the difficulties of getting that basic science research outside of the walls of the post-secondary institutions in a framework that's attractive to industry and that drives further investment. One of the pieces that always comes up from our end is, you know, it's the unsexy side of the industry that really drives economic growth, the supply chain. And I think we've had a lot more understanding of that as the pandemic came along. We started to realize, you know, as Pamela said, fill finish, you know, stuff like that really are actually critical to ensuring that we get the drugs that we need within a timely manner, especially in a pandemic scenario. You know, if we're looking at the opportunities here, you know, and I'll borrow something that I heard from one of my colleagues from Life Science Ontario the other day, that the top 3 biotechs on the NASDAQ have a market cap that's, you know, in excess of all of the Canadian oil and gas that's sitting on the TSX. And these are new companies. They're not blue chip that's been around for forever. These are companies from the 80s. You know, I think Gilead's one of them, based here in Edmonton. It's sole manufacturing site in North America outside of Foster City. There really is a big potential, and you know, I look at that from sitting here in Alberta, where we do a lot of work on the small molecule side and some of the active pharmaceutical ingredient production pieces. But there's a huge potential within Canada to really figure out how we move forward and how we grow companies here. And, you know, I think I'm really looking forward to a robust discussion amongst the other folks on this call about, you know, how we build this as a priority for the country. And again, as Pamela mentioned, you know, the intersection between jurisdictions, provinces, municipalities, you know, we need to figure out a way to approach this together to really build something that that grows the sector across the country. Thank you.
Oops, I was still on mute. Sorry about that. Okay, thank you so much, Andrew. Marina, you're up.
Thank you, Frank. Bonjour à tous. Good afternoon, everyone. Thank you for the invitation to join today's panel. I do apologize for being off camera. I'm Marina Massingham. I'm CEO of AFED Health. AFED is a Montreal-based startup. We're nearly 5 years old. And as mentioned by Frank, we focus on clinical decision support in mental health, effectively helping clinicians to make better decisions in the treatments of patients with complex mental health conditions, starting in depression. And at the heart of our technology is an AI model that we've developed for treatment selection. This personalizes probability of remission down to the individual patient level against each of the available first-line treatments, but without the use of any external tests or biomarkers. We actually came #1 in North America and #2 in the world, representing Canada in the 5-year, $5 million global IBM Watson AIX prize, that closed last year with this AI model for treatment selection, and are now initiating a North American clinical trial with sites in the US and Canada that includes the US Department of Veterans Affairs. So as a regulated deep tech company with AI at our heart, there are definitely areas in which we resemble more traditional areas of the life sciences industry, particularly when we're talking about doing clinical trials. As my accent would suggest, I'm originally from the UK, from London, but my interest in the topics under discussion today is very strong as the leader of an AI-focused Canadian healthcare startup. As a non-Canadian, I can honestly say I think Canada has tremendous potential in the life sciences sector, and really does have a world-class talent base, which gives Canada the potential to punch far above its weights. But there are some structural barriers in place today that perhaps prevent certainly digital and innovation adoption being as rapid as it might be, and growth as rapid as it might be, compared to the potential that we have in front of us. I would say that, especially being a relatively small market, continuing to reduce these barriers, continuing to grow capability and capacity in the sector is key to future success and growth. And I'm really looking forward to the conversation today, because I think, again, the potential of the life sciences sector in Canada is really tremendous, and I'm so glad to be a part of it.
Thank you, Marina. And I think that's going to be a very interesting panel, because I heard a few key words here and that are very interesting. I think first, I noted intersection of provincial and federal roles. We have to discuss that. Intersection of public and private research. How can we manage that? So I hope we can get back to that later. And potential. What do we need to go from potential to actual realization, successes, capacity building? So we have a chance to discuss all that later in the discussion. So I'm going to start with some general questions to you. Pamela, you quoted a UK licenses strategy or report. I'm going to quote this time a French one, and actually going to quote the president of France, who stated in the introduction of the France Healthcare Innovation Strategy, open quote, France is making a choice today that of not being a country that sees healthcare innovations created and developed elsewhere, but of being a country that takes its destiny in its own hands, assumes risk-taking to innovate, invent, produce, and sell its solutions to the entire world for tomorrow's healthcare, end of quote. Well, sometimes I dream to read the same quote coming from a Canadian Prime Minister, really. Especially when you look at the other nations with similar health systems that are investing already and a lot in life sciences strategies, and because they think they are important drivers of economic growth. So my question to you all is, what does Canada need to do to ensure it is not left behind in this environment?
Did you want me to start, Frank? Is that you mentioned my name? Yeah, like you, I'd love to see that. I mean, we are seeing signs, right, of Canada really coming to life around life sciences. But boy, we have to recognize we have competition from France and from the UK. They're already life sciences leaders, and they're kind of ahead of the curve. So I guess that question is, what is it we can do? And I'll start with relationships, partnerships, governance, that sort of area, because I think it's so important. And we've made such progress through the pandemic, working so closely together, calling each other late in the evening, on weekends, as we're dealing with pandemic issues. So I'd start with a comment about making sure we recognize the value of the sector and carrying that on beyond the pandemic. As I say, governments have started to see that potential and that critical role that the innovative industry, and I am speaking more with that hat on, the folks that I represent. But we've got a ways to go to move still beyond being seen as only a cost center, although, as I said earlier, the Minister Duclos did certainly recognize that. So this is a sector, the broad life sciences sector contributes significantly, both to health and economic well-being. So making sure that really becomes embedded, not just a passing fancy during the pandemic. And then the other part of that, as I mentioned, is valuing relationships and partnerships. Yeah, I'll leave it at that. That's just so important. It really is the foundation of the recognizing the value of relationships to get things going. We could talk more detail, but certainly having an IP and regulatory regime that is stable, that's reliable, that is competitive with other countries is going to be a key factor with regard to Canada being able to compete, to be attractive compared to other countries. And maybe the last comment, I'll pick up a bit on what Andrew said, because it's about seeking our sweet spot. And we need, as in Canada, to become a critical and important part of the global supply chain. We should not be focusing on or creating policy that smacks of domestic isolation. It's a global industry, it's a global pandemic. So what is Canada's sweet spot? Biomanufacturing investments are global decisions. We've been lucky to attract a few here, but I can't help but imagine how many more we might be able to attract if we had a few other things looked after. We have to recognize other countries are engaged in really exactly the same exercise we are regarding trying to build up that life sciences footprint in this very competitive global context. And we've got to find a way to stand out among many competing countries. Let's build our unique role. What's our value contribution within this broader global supply chain? So maybe I'll leave it at that as a kickoff. Thanks.
I'll comment next, and sort of build off what Pamela was mentioning and add in the other piece of, one of the big challenges, and I mentioned in my opening remarks, is that we don't, and I think I saw a question about it from the audience as well, is we don't take companies beyond the SME stage here very well. And if we're serious about building an industry here, we need to build a policy framework that encourages the translation and the scale up of companies here within Canada, both from direct investments from the government, as well as policy and other non-monetary incentives that ensure that companies can grow and scale here. I think that's absolutely critical if we're to hold our own in that space. And then, much to Pamela's comments as well too, when it comes to finding a niche, I think that's very, very clear that this is a global supply chain, and there obviously will be areas where we can have a competitive advantage, where we can have economic growth that's really focused on meeting a few key areas within the global industry. And there will be, from the pandemic standpoint, as reshoring of manufacturing, some of these other aspects come to fruition, there'll be a lot of growth in the sector that is more just adding to the robustness globally within the supply chain. But then there also will need to be some differentiation, building that sort of friend-shoring and networks that support the industry. And if we're looking at building it from an economic standpoint, the problem that we really face is here within Canada is in many cases a talent issue as well. Building the sort of talent that we need to ensure that industry can stay here and keeping it here with the incentives that enable folks to take risks, because as you're growing an SME into the next Gilead or Moderna, there's a whole bunch of things that can go wrong. So the ways that we can help build the sector are definitely very, very key in terms of the non-monetary incentives.
I just want to build on that. Yeah, talent is definitely very, very much important, and we need to make sure we grow our local talent pool, but also we need to be able to attract much needed talent in the life sciences sector from outside. And we also need to attract, international investments. So how can we increase actually Canada's attractiveness to achieve that?
I think there's an opportunity with, Canada's proposition as being, not quite Europe, not quite the States, and sort of that place where you can grow and build and really develop a family and a life for yourself. And then, building immigration policy that enables highly skilled workers to move quickly, because it is a global industry and a global fight for talent. And the more things that we can do, especially as the brand of Canada, as that that great place to live, to thrive, to grow, the more we can do to help promote that and make it easy for talent to move across borders is definitely important. I come from the weird perspective of being in Edmonton, where we have the added challenge of getting people to move to Edmonton when we're attracting talent. Some people love it here, but other people, they don't appreciate the cold. But I think that if we're building really sound economic policy that ensures that the sector is growing and it's growing in a way that's sustainable, there'll be folks that are looking to sort of set up their career for decades to come within the country, and also enabling companies to grow and scale, because the biggest challenge right now with the hot labor market is folks can't hire people here. They'll move to jurisdictions where they can hire them more quickly.
I would echo that, Andrew. I think that certainly as an AI business, we are in a hot global market for talent. Luckily, there's a lot of it already here in Canada. And I think if we go back to the discussion we've just had around what is Canada good at, what are the strengths that we should be building on, I think AI talent and our ability to grow that locally is definitely one of them. There's world-class universities here, educational systems here. And that obviously helps us to home grow. But I think, Andrew, to your point around the quality of life that's offered here, it really is very attractive versus many other areas of the world. And I say this as a Londoner transplant to Montreal. I have a much better quality of life than I could possibly afford to replicate in the UK. And I know most of my friends and family who are still there would absolutely agree with that. And that's something that can be quite underplayed. And it's definitely something that's in Canada's advantage versus other jurisdictions. I would also say that our continued ability to pay competitive salaries will be necessary. That does, for a small growing startup, I can tell you that it's a disadvantage to be on startup salaries when you're in a global war for talent. So there probably needs to be some focus on funding of startups that recognizes this challenge and recognizes that in order for us to be able to grow and develop, that we need to have mechanisms that help to level the playing field a little bit.
Yeah, very interesting. Marina, question for you. We saw that, in different recent licenses strategies in UK, in France, I mentioned it before, Denmark, they've placed a very strong emphasis on digitization. So, and you just mentioned our strength in Canada, in Quebec, and in Canada in general, to strengthen artificial intelligence. So my question to you, how can we better leverage that strength to improve health outcomes, and also drive economic growth of the sector? What's your take on that?
I think that's a really great question, Frank. So Pamela referred earlier to some of the work done in the UK. So I'll go back to that same theme and say that in the fall of 2021, the UK outlined a 10-year strategy to make the UK a quote-unquote global superpower. And they identified the key pillars that accompany that. So the key pillars they identified was investing in the long-term needs of the AI ecosystem, ensuring that AI benefits all sectors and regions of the UK, and governing AI effectively. So I think we can definitely borrow from some of this approach and adapt it to Canadian healthcare. And I think it's also interesting to note that the UK takes a 10-year horizon on this planning, given that their general election cycle is 5 years. So we're talking at least 2 cycles of government there. When we get more specifically to health, I think one of the things that I've seen that's encouraging in the AI sector specifically is the willingness of Health Canada to go outside of just looking and being focused on the Canadian market. And last year, in October, Health Canada, the FDA, and the United Kingdom's Medicines and Healthcare Products Regulatory Agency, MHRA, jointly issued good machine learning practice for medical device development guiding principles. So it's a set of 10 guiding principles that are important to be included in the development of good machine learning practice, which is intended to advance high quality artificial intelligence and machine learning enabled device development. I think to see this type of international collaboration in an important area of innovation in healthcare is great. And it gives me a lot of hope regarding future regulation of this sector and the ability, once you've met regulations in Health Canada, to be able to scale that approach into other international markets. So this is a very promising sign for us, I think.
Interesting. We all know that a critical ingredient for any licensing strategy is really, at the end of the day, the rapid integration of those innovations into the system, okay, the healthcare system. So, and this is true for AI applications. This is true for health technologies, but this is also true for biopharmaceuticals. So, my question to you, Pamela, is: in your view, what are some of the ways that we can use to accelerate really market access for innovations in Canada?
How much time do we have?
Until 2:25.
Just before, that's obviously a great question. Just before I dive into that, I did want to make one comment, if I might. Your earlier question about how do we attract talent and we make Canada attractive, I would say, and it does lead into this question, I guess, is we have to attract industry. So industry is here so we can attract talent. And, there are some key issues around, as I mentioned briefly, IP protection, streamlined regulations, championing innovation policies that do that incentivize instead of mandate, et cetera. All sorts of things we can do, I think, again, to make Canada more attractive for industry in general, and that in turn I think will be attractive for talent. So I just wanted to throw that extra point in. But with your question in terms of accelerating market access, again, there's so much we could do. James mentioned in the last panel about this need for a whole of government approach. I think that is a key piece, having government departments work together, not just even health and I said industry, but finance, TBS, et cetera. There's quite a few pieces that I think can be complementary and create a better environment. I mentioned earlier about effective partnerships between government and industry. We've made some really good progress on that front. Very happy with that. It's all about optimal patient outcomes as the driver. So we have to keep walking the talk on effective partnerships. I just mentioned, reference that other question, this need for a predictable regulatory, a strong IP environment for business investment, for R&D, for jobs. These are all key for a global industry. And just in terms of faster access, in terms of getting new medicines for Canadians, we're not faring very well at the moment. Canada's currently about, I believe it's 18th place out of 20 OECD countries, just in terms of getting from a first global authorization to public reimbursement in Canada. It takes about 1,000 days for a new drug to be reimbursed by a public plan. That's 3 years. So we definitely need to do more to accelerate that market access in Canada. Let's improve the use of integrated data. We've talked a little bit in this panel and the previous one about data and real world evidence, use that for decision making and particularly personalized treatments. And what else? Oh yes, new reimbursement models. I have to make sure I mention those. We've been really trying to promote some conversation about new ways of reimbursing, because that's often seen as a barrier to access, to market access. We launched a white paper. It's on our website at IMC. I think it was put up there in December, but looking at performance or value-based agreements, amortization models, subscription models, package models, portfolio models. This paper goes through these. There are others, but those are the ones we focused on. So let's bite the bullet. Let's take the plunge on exploring and implementing with these new models. Maybe, Frank, just the last thing to mention on this one is I'd probably be remiss if I didn't mention pharmacare at all, given how much it is in the environment these days. And quite candidly, the government's plans with regard to a national pharmacare program could be a factor depending on what unfolds. So a too restrictive formulary elimination of private plans. These are factors that will diminish access to innovative products in Canada, and that's going to reduce our attractiveness as a country in which to launch new medicines, vaccines, conduct clinical trials, invest, and those sorts of things that we all want to see happen. So I'll maybe end with that.
Thank you, Pamela. Andrew, as you know, access to capital is really critical. For a robust and thriving life sciences sector, we need capital for our SMEs, our startups. I understand that your organization has really recognized the challenge, and you have created the Life Sciences Investment Summit in partnership with the Startup TNT. Can you just tell us a bit more about this initiative?
Sure, absolutely. And I can talk a little bit more broadly about the challenge. A lot of times, and this is very common in the innovation space, where if you ask SMEs what the biggest problem is, access to capital is always first and foremost one of the biggest challenges that they raise. But the concept of access to capital is not just one of we need to promote our jurisdictions and get investors to come here. It's also about building the very solid company and something that can stand up to due diligence for those investment pieces. One of the worst things we can do is go out and promote Canadian companies that aren't yet ready to be in that sort of global realm of capital and investment, because then people look at the region and say, well, you guys don't really have all of your ducks in a row just yet. So that's one area that we do see a big challenge of. And then also too, in the local investment community, and this is a little bit about that investment summit that we've been talking about. And this is, probably less of a challenge in Quebec, but it definitely is a challenge in Alberta. And it's probably a challenge nationally, where, we have a lot of investment that's and investors who are used to investing in more traditional types of business. They don't really understand the life sciences industry. It's nebulous. It's hard for them to understand what the risks are, what the rewards are. And so one of the things we've been working to do is educate and expand that investment pool. Right now, we're doing it at the sort of pre-seed stage rounds, where we're looking for companies that are raising, about $1 million to do some initial de-risking. And one of the things that we're doing is we're working with companies both to get them to understand what they need to do to stand up to due diligence, but also working with investors to educate them and get them to understand, what makes a investable company in the life sciences, and getting them to understand, the real sort of challenges that are in front of a lot of these companies, and reading between the lines of what what a good plan is to take a drug to market, and what a sort of a little bit more of a optimistic plan, to speak euphemistically, is for a lot of these companies, because there's a lot of capital sitting on the sidelines here within Canada, especially within Alberta, where there's been folks who have made a huge amount of money in the oil and gas sector, investing in small SMEs that were oil field supply companies or exploratory, and there's an opportunity here to leverage that capital for Canadian companies, as well as attract capital from around the world. But we need to get companies good at passing due diligence, and we need to get investors good at doing due diligence here within the country.
Okay, so we're getting close to the end, and we're going to go to the questions from the audience. But I'm going to ask you a last question. I'll ask you to answer quickly to my question. So the government's biomanufacturing and life sciences strategy has articulated important objectives, for the sector. But like sometimes or often, federal strategies, they tend to lack a little bit of detailed measures and initiatives to really translate into concrete actions. So if you had to pick one, what would be, what do we need to focus on to ensure a broad implementation? So you can pick only one, and I'm going to ask the same question to the three of you. Who goes first? Pick one is difficult, huh?
Well, I'll jump in here, although I can't pick one, but this is really unfair. We didn't script this, but I think what I would say is we need that actionable national strategy. The current plan prioritizes biomanufacturing. I get that that was a first priority, especially in a pandemic, but it's only one part. So comprehensive, coordinated, collaborative, the entire life sciences spectrum that will, is going to build that sort of growth-oriented life sciences sector, and ultimately enhance patients' access to innovative new medicines. That's what I think we're all driving for. And so within that, use what we already have, as I mentioned earlier, the Health and Biosciences Economic Strategy Table report, or the Chamber's Life Sciences Council plan that's going to emerge soon to build that. And so I guess I would have to say that, although I have other things I'd like to say whenever there's time.
One note I would add on it. So there's, I think that there is a lot of promise out of it, but again, it was something that was born of a pandemic, and so it needs to be implemented strategically. It also needs to be implemented, across the country. I think there's a lot of potential in the various provinces that they can all bring to bear, and it also too, again, focusing on a specific technology or area is again something that brings risks with it, because you don't know if the horse you're picking is the one that's gonna win the race. So I think it's an opportunity to really try things out, and look at models of growth and success. The other piece is, it needs to be more than just matching funding that's going to a multinational that's setting up a manufacturing plant. It needs to be about building the grassroots of the sector as well, so that those companies have reasons to stay here, so that we can build out the next great unicorns out of Canada in the life sciences space, and we really provide that integrated approach that benefits both, because sure, someone will make an investment because the money is right, but we need to ensure that they're able to stay here, and I think that really calls for a national integrated strategy when it comes to how this is looked at. And it's much bigger than just manufacturing. It's a huge sectoral approach that will take a lot of work, but also won't take a lot of reinventing the wheel, because a lot of this work has happened at the provincial levels, municipal levels. There's so many reports that all say the same thing. We just need to put them all together and really drive it forward as a country. Yeah.
Marina, you want to add something?
I'd echo what was said before. I think a clear, consistent strategy with milestones attached is necessary for companies who are investing and growing in this sector to be able to plan effectively. So whether you're a small growing business or whether you are a large multinational who wants to further grow in the Canadian market, you need to know what's coming, and you need to have visibility into that, and you need to know that it's going to be consistently applied, as Andrew said, across the country and different areas of the life sciences sector. So I could see that being universally beneficial to all types of players in the Canadian life sciences sector.
Okay. And actually, we do have a question from the audience, from Christy, that building up on the same topic, that says, the government's biomanufacturing and life sciences strategy highlights governance as one of its fundamental pillars. What are some of the key considerations with respect to this topic? So governance, any thoughts?
I'm happy to kick that one off. I'm very glad that question was raised. We've been having some recent conversations about that in a number of different fora. Everyone's talking about life sciences right now, and certainly in terms of the biomanufacturing strategy, it identifies governance as one of the 5 pillars that it's building on. And I would say it's number 1, because until we get that sorted out, making sure that the appropriate stakeholders are involved, that we have accountable leadership at the government level, but also across a number of stakeholders, that until we get that sorted out and embedded, the rest will not be as easily unfolded, I guess I would say. So that to me is the number 1 priority. If government asked us, what should we do first in here? Well, let's start with the governance.
Good. Any other thoughts? Okay, I do have another question from the audience, from Vincent, excuse me, who's asking, as mentioned by the panelists, Canada is competing on the global scale for talent, but the financial resources of our SMEs is limited to the funding. Are we undervaluing our SMEs and putting them at greater risk of failure / acquisition? I think the question goes to Andrew and Marina, probably. So, undervaluation of our companies?
I can start to answer that. I think it is a challenge when you are trying to attract global talent and you are in a market where valuations are less high than they are, for example, south of the border. It can place you in disadvantage to get enough capital in order to invest in the people that will allow you to compete effectively here at home and also abroad, because we're talking internationally, and I can say as a business in AFRED, I think internationally depression is a global problem. So I think that there is a challenge. I see it gradually starting to change, because what's also happening is that as more investors come into the Canadian market, there is a diversity of viewpoints, and this allows us to push for higher valuations, which allow us better access to capital, but it's slow. And I'd like to, this is certainly, I think, one area in which acceleration and better valuations for Canadian companies can help us to grow and compete.
Andrew, anything to add?
Yeah, no, I agree with that sentiment. The other piece, though, is worth mentioning is looking at the sort of a quality of life, and again to those softer factors of the salary piece, where in Montreal is a good example, Edmonton's a good example, maybe not so much in Vancouver or Toronto, but the dollar does go a lot further here. And I think educating the global market on some of those pieces is again important, because there's a lot of stuff that, if we're talking about companies from Basel, Switzerland, the costs associated with living in the jurisdiction is dramatically different. And so, that also, I think, needs to play a bigger role in terms of how we recruit.
Okay, so we do have a follow-up question from Ezra, asking basically, why do we have so much trouble growing beyond the startup and SME stage in Canada? And the famous unicorns, why don't we have those unicorns here in Canada, in life sciences at least? Is that just a question of access to capital, do you think?
I think that's part of it, but I think we also need to do is see stronger home adoption. It's actually quite difficult to get new innovations commercialized in the Canadian healthcare market. And if we are able to increase our capacity to do this, first of all, the companies that are commercializing those innovations get great learnings. They get a stable base of homegrown revenue. And also, when you're expanding internationally and growing your revenue base, it is an advantage to be able to say you have home country adoption. So I think if we become better at finding that path to innovation and adoption within our healthcare system, that will definitely be helpful. There are obviously other structural things, and we could spend a very long time on this question, but for me, that would be access to capital and also home market adoption would be two things that would prevent us from easily growing SMEs in this market.
One of the things to add on to that I would put is the talent piece. The biggest reason that folks move elsewhere, in many cases south of the border, is as they gain money, they can't access the right expertise that they need to grow within Canada, and so they open up an office in the States or elsewhere to leverage folks who have done it many times and are very seasoned, and then next thing you know, that's where their entire team is being grown. So the more that we can do to support the development of talent here within Canada, the retention of it, as well as the attraction back, I think that is a big piece that we don't really think about. Our post-secondary institutions train for the global market, and a lot of the grads from Canadian post-secondaries have gone on to phenomenal careers in industry. So, for example, within our group, we've got Brian Corrigan, who's the global head of clinical pharmacology for Pfizer. He grew up in a small town just near Edmonton, and went on to basically lead all of Clin Pharm for Pfizer. And especially as we get into more of a virtual world, and we've had conversations with these types of folks, getting them to come back, to give their talent, give their support and guidance to help build the seasoned young minds and experienced hands on the tiller here within Canada is critical, because we've got brilliant people. We just are not that great at building the environment for them to stay here as their careers take off.
Great. So we're getting close to the end of the session. So we're going to ask all the panelists to provide it with some closing remarks. And I'll start with you, Marina.
Oh, sorry, I started off on mute. So I would say that this has been a really interesting discussion. I started off by saying I believe in Canada. I really do believe in the potential of the Canadian life sciences market. And I see all the right foundations for positioning life sciences as a vector for economic growth. And I think there are definitely areas in which Canada is strong and can be internationally competitive in the sector. I won't repeat everything that we've discussed today around areas to be improved and leveraged, but as a growing startup, I can definitely say access to talent, which is something we've covered a lot today, is very important to us in our future growth. Access to funding, home market paths to adoption, and simplified and harmonized regulatory frameworks, particularly when we're talking outside of Canada, and harmonization with UK, FDA and other regulatory bodies are probably the highest priorities that I see today. I came on board at AFRED as professional CEO back in 2019. I'm actually not one of the original founders, but one of the reasons I came on board is because I believe Canada is a place where leading technologies can be built in healthcare and supported by a growing and thriving life sciences sector.
Thank you for this very optimistic message. Andrew?
Thank you. So thanks so much for having me participate on this panel, and thank you both to my two wonderful panelists as well. I think we had a great discussion, and I think that really clear here, there is a huge opportunity for Canada in the coming years ahead, and we need to work hard to ensure that we don't miss it. We need to ensure that we nurture the life sciences sector across the country, and really build what could potentially be one of the huge economic drivers for our country for the years to come. And as we look at it, it's something that's related to digital health and AI. It's biologics. It's small molecule drugs, natural health products. You name it. There's expertise here within our country that is world leading, or at the point where we really should be doing a lot more as it relates to the economic impact coming out of the work here in the country. So I think it's our opportunity to lose, and I think coming together with industry, policymakers, post-secondaries, and other groups over the next few years will be critical, and it needs to be an environment that's focused on results and building tangible wins for the country in the space, and figuring out how we can do that together.
Thank you, Andrew. So transforming once again that potential that we have into actual realizations. All right, Pamela, your final remarks.
Yeah, thank you. It's been so great to be on this panel with Marina and Andrew, and people I hadn't met before. Wonderful to meet them and to have different voices, I guess, contribute to this conversation. And I guess I would just say in summary that this, as I started, this is really the time for Canada to adopt that cohesive policy framework that starts to reduce regulatory burdens, offers opportunities, investments, expand advanced R&D, the in-house manufacturing of medicines, all these things we've been talking about. This is our moment, this is our time. IMC, all of our members, we're keenly interested in working with government, help convene the appropriate policy conversations with all the key stakeholders that need to be there for open and inclusive conversations. We know that there's a lot of different paths to reaching a same objective, but really it's only through that consultative process, a collaborative process, that will get us to the best solutions for Canada. And I would add, there's no time to waste. Science, medicine is increasingly offering all these promising new opportunities, therapeutic possibilities. we're probably most of us Canadians on this call and have a bit of pride in the country. We want ourselves to be positioned as a leading jurisdiction for these new product launches. It's going to take all of us with our sleeves rolled up to do that. Maybe the concluding piece is I'll just draw from a bit of a model that we pulled together at IMC in terms of building that world-class life science sector. 4 points. We need industry government partnership. We need to support the uptake and adoption of life sciences innovation. Definitely need to implement agile, efficient, predictable regulatory systems. And of course, enhance Canada's international attractiveness. I think we're capable of doing all of that. It just requires us to continue working together and make it so. Thanks, Frank.
Thank you, Pamela. It was fantastic, really. What I get out of that session really is that, yes, we have challenges like talent mobility and attractivity, access to capital, home adoption of our technologies. But I think that for me the key message today is that we must make sure that collectively we do recognize the value of our sector, because after all there are so very, very few other sectors that have such an important impact on health and life of Canadians, right? So we do need to recognize the value of our sector. So thank you so much for your insights, my dear friends. I really wish we had much more time to talk about different topics we wanted to talk about, but I think we have to wrap things up. So I guess I'll now turn things over to the Canadian Chamber of Commerce, to the Vice President of Quebec Policy, Cathy, for a few closing remarks. Cathy, the floor is yours.
Merci, Frank, and thank you to all our panelists and moderators for your contributions and for bringing the barriers and opportunities facing the Canadian life sciences sector to the forefront today. As today's discussion showed, there is no shortage of opportunities for both the public and private sectors to help create the globally competitive, integrated life sciences sector that Canada both needs and deserves. There's so much potential just waiting to be unleashed, and today's event leaves no doubt in my mind that we can get there. For our part, the Canadian Chamber's Life Sciences Strategy Council, Pamela alluded to this, will continue to work to support knowledge sharing, networking, research, and advocacy aimed at bolstering Canada's standing as a world-class, secure, and sustainable life sciences player. A big thank you to our council co-chairs, Leisha Babiak of Johnson & Johnson and Gordon McCauley of Admare Bioinnovations, who you saw earlier speaking with the minister, and to all our council members for the work they're doing to accelerate Canada's progress. A heartfelt thank you as well to our keynote speaker, the Honorable Jean-Yves Duclos, for taking the time out of your busy, hectic schedule to share your insights with us today. I'd also like to thank our sponsors and members for making today happen. We couldn't have done it without you. And of course, a big thank you to each and every one of you, our audience, for taking the time to join us today and to be part of our conversation. Our Executive Summit Series has 4 events still to come in 2022, covering everything from national security and AI to ESG and cannabis. So if you haven't already, please visit chamber.ca/events to learn more and register. Au nom de tous les membres de la Chambre de commerce du Canada, un grand merci et au plaisir de vous revoir prochainement.